The journey involves having a month whereby we would initially do tests in order to look at your ovarian function. These tests are performed by doing an internal scan. In the internal scan, we would look at the egg reserve, so the number of follicles you have, and at the same time we would also do some blood tests to look at the hormonal levels. This would give us a very good clue as to what dosage of medication to give you and what drug regime to put you through. The second check involves assessing the womb cavity. This is done by a process known as saline infusion sonogram or hysteroscopy. At the same time, we would also assess the sperm. You would either use partner sperm or donor sperm depending on your situation. Once we've done all our checks, in the next month, treatment would begin. Treatment would involve taking medication in the form of injections. These injections are usually administered on a daily basis. Once you've started the injecting, we would then start monitoring by doing scans and blood tests. These scans and blood tests are typically done every other day. By roughly day 14 in your treatment, we would expect that you are ready for egg retrieval. The egg retrieval process involves putting a needle into the vaginal wall and collecting the fluid that's accumulating within the ovaries. This process is done under sedation, so you're put to sleep and it would be pain-free. At the end of the procedure, we would tell you how many eggs are collected. Once we've collected the eggs, you would go back to the recovery area and we would then take the eggs, use the sperm, and either mix the egg and the sperm together or inject the sperm into the egg depending on the sperm quality. The following day, we will give you a ring to tell you how many of these eggs have fertilized. Once we have embryos, these embryos are then monitored on a daily basis. Typically, embryo transfer is performed 3 to 5 days post egg retrieval.